Well, doctor, I know, the numbers for today just came out. And again, the case numbers are really high. What do you tell people about, the picture right now with COVID, and now almost 2 years into it, it doesn't look any better?
Yeah, I think what you really see right now is the Delta and Omicron together. It's just really creating quite a soup of viruses right now. And you really see the prevalence is quite high. If you go back to Veterans Day to where we are now, the case rate's 10 times higher. So it's a lot higher. This is, hey, we had holidays, we gathered, the weather got colder, we went inside. This is what's contributed to this. So there's just a lot of COVID out there right now. So right now we've had the most cases now than we've ever had. Even though it's been 2 years, we're seeing prevalence is higher than it's ever been. So it's important to note this, prevalence is high. Therefore, I should act differently. And what I mean by acting differently is I probably should stay home if I can. If I'm going to go outside and going to be anywhere in an indoor environment, I better wear a well-fitting mask. And I really better cover my mouth and nose and take it seriously this time. Even doing simple things like this would make a big difference. And the other thing to remember is if I want to do something different, if I haven't gotten vaccinated, I really ought to get a vaccine. I don't know what would have been holding me up at this point, but I would definitely get dose 1. But for the population that still hasn't gotten their booster vaccine, I would definitely get your booster. And it's important to note, Pfizer made that announcement yesterday through the Food and Drug Administration, that if you had a Pfizer vaccine, dose 1 and dose 2, your third dose now is due 5 months after. So those are 3 things you can do. Stay at home, wear a well-fitting mask when you're indoors, and make sure you get that booster vaccine.
For people who see the numbers, skyrocketing and wonder if the vaccine is working, what do you say?
Yeah, so the vaccine is working. We're just seeing a lot of cases. Keep in mind, the vaccine does protect people from serious disease. Keeping you out of the hospital and dying, it does really well. But, right now, just keep in mind this little analogy. Maybe it'll work for you. Michael Jordan and I both play basketball. One of us plays a lot better than me. And the bottom line, if you're vaccinated, you're kind of like Michael Jordan playing basketball. You're protected against COVID. If you haven't gotten the vaccine, you're not protected. And that's where you really need to look at getting protected.
What do you tell people, right? As you mentioned, people got together for the holidays. So, Christmas now 10 days ago, New Year's a little less than a week ago. I know with the guidelines on quarantining, or, if you got COVID or maybe you were a close contact of someone, how do you simplify it for people? I mean, I know, so if you're fully vaccinated, if you were a contact of someone, you can still go about your business, but how do you simplify it for people, what they should know, especially now as we're 5 days out, I guess, from New Year's though, and those guidelines have changed?
Yeah, the main thing I would keep on my mind open to is looking for symptoms. One of the things about Delta and Omicron is it often starts very mild with people. So if you're feeling a little bit tired and a runny nose and a headache, you might be like, well, that's just my usual feeling on a hard day at work. Well, that could be the start of COVID. That would be a good reason to get a test. So that's one thing I would think about. If you were at a holiday gathering and you start feeling a little bit off, like a little tired, headache, runny nose, just something minor, try to get a rapid test or a PCR test and answer that question so you're not living with that doubt.
And so do you think people are getting over tested right now? People who don't have symptoms or for other reasons, or, I know around the holidays, a lot of people wanted to get tested before getting together with people. Do you think that's an issue in clogging up the system?
Yeah, I think the testing demand is incredible right now. It's interesting. Yesterday, we tested 26,000 people, which is a lot. I think one of the things I'd be thinking about, if you're asymptomatic and haven't been exposed to anybody, this isn't the time to go get a test. So I would just put that out there. If you don't have any symptoms, you weren't exposed, then this is not the time to go get tested. And I think if we just think about this too, you really don't need a test to get back to work. If you had a positive test, you don't need another test to get back to work. That's another thing too, is if you're COVID positive with an antigen test, you don't need a PCR test to prove it, you're positive. On the other hand is look, once your 5 days of isolation is up, if you can wear a well-fitting mask, you can go back to work. And I think these are things that would help declog the healthcare system, the testing system in particular, a little bit.
And I just want to be clear on the 5 days. So if you had symptoms to start, is it 5 days since you're symptom free, or is it just, it's been 5 days and now I no longer have symptoms, even if it's only been 1 day without symptoms? Can I go back to work?
Yeah, so the isolation guidance really just changed a little bit, and I think we should make it simpler for people. You're still isolating for 10 days, but after 5 days, you can leave your home as long as you're wearing a well-fitting mask. And so when you really think about it that way, it's not that different, but it is more practical, right? So in other words, it's still 10 days, but after 5 days, I can leave my home. As long as I'm wearing a well-fitting mask, I can go do life. I can go back to work if I need to. I can go do other things, get my groceries, do other things. I think that'll make isolation a lot more manageable for people.
What do you say to the people who are struggling to find a test though right now, whether it is a rapid test at a store or an appointment for a test?
Yeah, if you're struggling to find a test, we're with you, and we're working our best to make it more available. We're seeing more testing come online every day. So we are rising to meet the demand. I've seen that in the last week. We're seeing more testing happening. The important thing though is if you have symptoms, please isolate. Like one of the things is don't wait for your test to be positive to isolate. If you have symptoms, runny nose, cough, tired, whatever, stay home until you get that test result. Because if you have symptoms and you're running about town, that's when you're spreading the virus at the most. And that's creating more disease for people. So that's what I need people to do. If you're waiting for your test result or waiting even to get a test, you need to stay at home until we get your test result.
And finally, Dr. So you're here in front of me for the health department. I know some people are upset that, maybe people should have seen this coming and more testing and other resources should have been made available around the holidays. What do you say to that about kind of the state's response and in terms of, it looked like things were getting better, but then maybe people should have known that this was coming?
Yeah, I think there's a couple of things to keep in the back of your mind. One is we've done our best to get testing widely available. We're having a hard time getting tests. So to some degree, it's a federal distribution problem, but we're trying. Right now, what's limiting us is actually the test kits. That's what's limiting us. When it comes to shortages of treatment, like sotrovimab and other monoclonal antibodies, it's really a national issue. And we're all in this mess together, as a country right now. And that's one of those things. But, quite frankly, we've been telling you in Rhode Island for a long time, wear a high quality mask when you're indoors, get your booster vaccine. And I think if there's one thing we can predict about the pandemic is it hasn't been all that predictable right now. But I do think it's safe to say we're probably in the last big surge of this. So I don't think people should be discouraged. What I see happening right now is this is going to peak in the next couple of weeks and it's going to start to drift down again. It's possible by St. Patrick's Day, we're talking about the pandemic in a much different way, that it's really in the most part much more under control at that point, and we're getting ready for a nice normal spring. That's what I'm optimistic about.
Well, since you talked about that, I'll ask you this too, and I know you've talked a lot about people's mental health as well for this whole thing. What do you say to the people who are like, oh, we're almost 2 years into this now, we thought it would have been over maybe by that summer of 2020. Now it's not, it seems to be just as bad as it was at the peak. What do you tell people? I mean, do you really think this is going to be it hopefully in a couple of months?
Yeah, I think it's going to be over in a couple of months. And here's the reason I think that. If you remember what got us in the problem in the first place as a species, nobody was immune. Quite frankly, no one had any immunity against the original COVID. When you really think about what's going to happen in the next couple of months, either people are going to be vaccinated or recovering from their infection. So I think you're really going to see a lot of the population has really got that immunity. And this is really just to me underscoring is we don't have as many people vaccinated in Rhode Island as we would like, but we sure have plenty of people who are vaccinated. So that's why I'm optimistic that this is probably the final surge we're going to be dealing with right now in Rhode Island. And then we're going to see more normalcy coming up in the spring.